Hello, hello. Thank you for joining me. So, with the digital camera uses, we all are getting a lot of our pictures taken, whether we like it or not. So, if someone has discolored a teeth or a tooth, then it's going to make them feel very conscious about their smile. So, today I'm going to talk about what causes the discoloration and how we can fix it. And before I dive in, my name is Dr. Mansi Oza. I'm a cosmetic and a general dentist. I'm the owner and the founder of Thurmont Smiles. When you're a patient at Thurmont Smiles, you will become our family member. We are passionate about helping you smile more and smile confidently. Our team has a combined experience of 50 plus years, and I'm personally doing it for 23 years now. And I've helped thousands of patients with discolored teeth, and we are here to help. So let's discuss some causes for the discoloration. So the most common cause, and a little bit of a heads up that, I'm going to show the pictures of the teeth because that makes it easier for me to explain what I'm talking about. So hopefully you don't mind that. And you will also understand that little better, I think. So the most common cause for tooth discoloration is the food. And this would be the outside or extrinsic cause. And you can see here some of the darker foods like coffee, turmeric, curry, wine, smoking. Sometimes some medications can cause some discoloration. And this can be easily fixed by teeth whitening and, decreasing the consumption of dark foods. I have discussed teeth whitening in detail in my previous posts and videos, and I posted a lot of pictures. We specialize in teeth whitening. We have whitened Miss Maryland's teeth and a lot of pageant and title holders' teeth. So that is something we really like doing, and we have our protocol down so we can get good results with that. So that is the extrinsic staining, meaning the outside surface of the teeth gets discolored. The other cause here, so you may have noticed you may have a dark tooth, or you may have noticed a dark tooth in someone's mouth because it just stands out. It is just right in front, and the front teeth, they get hurt very easily. So it could be if someone's playing sports, or if they get bumped into something, or if they were in a fight, the front tooth really gets hit very commonly. I see this all the time. And what happens is each tooth has a nerve inside it, and it also has blood supply. So the dark discoloration that you are looking at here, it comes from the blood clot inside of the tooth. So obviously we need to clean out that blood clot to treat it. It is done by root canal treatment. Most people don't like hearing that, but we need to clean the tooth. Sometimes it's infected, sometimes it's not, but it's definitely a dead tooth. And then once that is done, depending on what's on the outside, so the picture again here, what you're looking at, it has a dark tooth inside, and then there is a filling that has darkened also on the outside. So we do a treatment called internal bleaching after the root canal is done. So the root part of the tooth is completely sealed, and then on the inside, coming from the inside, we just put some dressings like 2-3 times, sometimes more, and the tooth gradually whitens. So in many cases, you don't even need any filling or crown or anything on the tooth, and just doing that treatment can completely change the look of the teeth. I'll be posting some pictures there at the office, and I couldn't find them today, but I'll be posting some before and after pictures of that wonderful treatment. It is quite conservative treatment. So let's look at some other causes of teeth discoloration. So you see here, this is the gums are darkened because we use a special software to really study the teeth. But what you're looking at, that on the left side of your screen where I marked it in green, the natural teeth, they look nice and shiny and they look alive. Whereas in the center where I have written type of material used, those teeth don't look as alive, or they are not translucent. They are completely blocking the light and they look like they are discolored. So the previous dentist had tried to match that central tooth, and they have done a pretty good job, but because it does not look translucent, it looks dead. The other causes you can see here in the bottom where it says root exposure, the roots are darker than the enamel of the tooth, so you see that discoloration right around the gum line. So to treat these discolored and mismatched teeth, we obviously have to remove the previous restoration, see what's inside, if the tooth is dead or not, and then with the help of our lab technicians, or we can also do this in the office, and depending on your goals about your smile, if you want a nice even broader smile, then we have to cover the teeth with some porcelain, and we can make them look really natural, and you would be very happy with the results. If you have some root exposure, like again if you're seeing here, then we always have to find out the cause for the root exposure, because it's not normal to have the roots exposed in the mouth. So we have to do some bite analysis and make sure your bite is right on, so you're not continuously putting forces on your teeth, because you can crack or lose the teeth in future, which is not what we want. So one more picture here. So here you can see that there are different materials used on the right and left side of the screen. The previous dentist had used some porcelain material, but then they had used metal on the inside. So you can see right around the gum line, more on the top part where the gums and the teeth meet, you can see some discoloration. And I've had a lot of patients who felt very conscious about that. So again, we have to remove the old restorations, see what's inside, make sure everything's nice and healthy, and convert that into metal-free porcelain restorations, and make sure the smile is even, the bite is perfected, and everything looks nice and natural. One other thing here I have. So these were the pictures taken with my patient had some mercury fillings in their teeth, and we many of you may know we are SMART certified, so we safely remove the mercury, so you're not inhaling or swallowing any metal particles. And the treatment here was very conservative, so you can see the after pictures there. I did not have to remove much tooth structure at all. That is, usually always my goal, because the tooth structure does not grow back. So if we can keep something as small as possible, then that can give you a big advantage for future. It can last you a lifetime, or if you need any treatment in future, then we have more tooth structure to work with. So here in this picture, I just simply changed out the mercury fillings to the white fillings, and made the teeth and our patient healthy. So discoloration can be caused by mercury fillings. I see that like really very often, probably 2-3 times a day. And unfortunately, in old times, the dentists used to put the mercury fillings even on the front teeth. So I have seen cracked teeth because of that, and darkened teeth. So that is one of the reasons why the teeth would discolor. Yet another reason here is cavities or decay. You can see the cavities, the bacteria stain the teeth black, and they have on the right side where I have marked, there are multiple different attempts made to restore the tooth, and there are some filling materials and bacteria have invaded even behind the filling and caused the darkness. So obviously we have to treat that all, and if the filling gets too large, then the tooth alone cannot hold the filling, another filling inside. It would discolor again, it would crack. So we have to convert that with some porcelain restorations. We do have other options like snap-on smile, so that I have discussed in my previous video. So if you want more options, either reach out to me or look at the snap-on smile video that I have already posted, and I'm going to post some more videos soon also. And one more picture I have here. So here our patient had some dark cavities right around the gum line. You can see I marked it with decay, and all I did was just simply treated the cavities with cavity fillings. And thank you for liking my post. I'm in my video. I don't know, I can't see who is on, but thank you for watching with me. So anyway, the patient had decay around the gum line, and I just conservatively treated that. He did not want to do anything with his smile. He was happy with it. So I just filled the teeth, conservatively, and he's happy. Big difference with, just smaller restorations. So, obviously I could not include all the causes that, for discoloration of the teeth, but I tried to cover some. If you have any specific questions, just reach out to me anytime. And I wanted to remind you that we are still accepting applications for our completely free, all expense paid smile makeover competition. We do it only once a year, and we all at Thurmont Smiles really look forward to helping someone who deserves a makeover. So if you don't need it, please forward my post. I have pinned the post on Facebook, so forward my post to anyone who you can think of who could benefit from a makeover, help them move forward with their life. It could be your friend or your neighbor or a UPS driver, anyone. Just, we can help anyone. So that's pretty much it. I'm always available via direct message, so message me anytime. I try to reply immediately. We are in the office from Tuesday to Friday, so during business hours, our team is always ready to answer your questions. And the number is 301-271-4400. So thanks again for watching. I appreciate your time, and I will see you next time. Take care.